scopes, and you do. The most important thing you can do to let us do it laparoscopically is to come in weighing less than today. Okay? And it has to do with our friend the liver. So we'll say this is somebody's belly. We won't say whose. Spleen's over here, diaphragms are here, heart's in the chest, lung here, lung here. It's kind of a normal stomach-liver relationship. But if you're gaining weight, just a pound a month, 12 pounds a year, 120 pounds in 10 years. If you're gaining weight, the liver looks like this on the inside. It's about 3 or 4 times its normal volume because of fat within each individual liver cell, fat in between the liver cells. Okay, and that's what this fatty liver disease problem is. And the main reason I have to go from the scopes to an incision is I can't see behind the liver. The liver fills the belly cavity, almost like a cast of the inside. Now, if I make an incision from the bottom of your breastbone to your belly button, I can rotate the liver out of the way and do my work. But with the scopes, the belly is closed, there's no place to move it. So this is what this is about. If you want to have it done laparoscopically, and it goes, they're all the same, because this is the part where we got to do our work. If you want it done laparoscopically, come in weighing less than today. You know, do the South Beach, do the Atkins, do the OptiFast, do anything that has worked. Don't make every supper the last supper. Okay? Don't try to go get all of the things that you think you're not going to be able to eat. You know, don't go get one more world's greatest pizza. Okay? I mean, this journey that we're going on to give you your health back, to save your life, starts today. Starts with this educational thing. You know, anything you could do to start a walking program, you know, get some air in the bike tires, get the bike out. Train for this like you're training for the fight of your life, because you kind of are. You know, come in as fit and as strong as you can with your weight down a little bit. Okay, so the first thing we do in the morning of surgery is we put a scope in around your belly button and we look around. And if it looks safe, I'll do it laparoscopically. If this looks like a really bad idea, I need to know what to do. And we'll talk about this the morning of surgery. You know, at that point, the choices are take out the scope, put on a Band-Aid and send you home, or make an incision and get this done. And almost everybody says, don't you dare send me home without this. I've been through too much to get here. This is too important. You know, having an incision is not the end of the world. We used to do them all like that. But having a complication because I couldn't see could be the end of the world. And if at any time during the operation, the little birdie that sits on my shoulder says, this approach is seriously endangering this patient, then we switch to an open operation at that time, okay? And no apologies. It has to be safe. We cannot seriously compromise your safety to have a smaller incision, okay? And it's almost always somebody who's gained a bunch of weight. And somebody that has gained 20 pounds between today and the day of surgery, that also tells me that emotionally they're kind of not ready for this. You know, because you got to be involved. You know, you got to be engaged. You have to start changing.